Thanks for having me. So what other, just out of curiosity, what kind of things have you guys been learning about this? Is this like a series of trainings?
We talked about alcohol withdrawal one day, and we talked about opioid addiction and how we handle that.
Okay, perfect. Okay, so I'm Amy Hill, opioid outreach specialist for Snohomish County Human Services. Had the privilege of working with Robin for quite a few months there, a while back. So Gale reached out and had questions. You guys maybe wanted to know a little bit more about the street trends, street drugs, things that are going on. Opioids are my specialty, not personally, but what I do. So I want you guys to ask questions if there's anything that you have specific questions about. I'll do my best to answer. I've been the opiate outreach specialist for almost 2 years. I worked at Evergreen Recovery Center for 5 years prior to that. Spent 3 of those years in the Snohomish County Jail as a counselor. I was the in-jail treatment counselor, worked with the women in the jail. So I've heard a lot of slang, I've heard a lot of different phrasing for the drugs that are specifically out in our county. So, why is there an opiate outreach specialist in our county? A couple different reasons. One of them is Snohomish County started a program back in April 2014 where we began providing NARCAN to every law enforcement officer in our county. So since then we've had 183 saves from opiate overdose, and the situation that was happening prior to my job was the officer would provide NARCAN to a client, they would wake up, and then typically they're going to go back into their life. There wasn't really any reason or person or anything that they could do to change. So the goal was for there to be my position, which is a liaison, working with people who experience overdose, help them get into treatment if that's what they want. As you guys know, I'm sure not everybody wants to go to treatment, but meeting them where they're at and try to find a good place for them. I also do NARCAN trainings for the county, public trainings for people who want to learn more about opioid addiction and NARCAN. So this slide is national overdose deaths. This is just involving opioids. So 2002, most recent is the provisional up through 2017, over 49,000 people, and this is just specifically opioids. This is just the heroin. So you can see in 2011, that's where the increase started. That's when the OxyContin formulation was changed. So people were no longer, unless they wanted to pay $80 for an Oxy 80, they switched over to heroin. You could get the same high for about $20 worth of heroin as you could from one Oxy pill. You see the trend is...
Did they expect that to happen when they made those changes?
Oh, I doubt it. I don't know, but I don't...
They really had no idea that they would take away something and then an addict would look for something else. That never crossed their mind.
Well, I think there was also a point where there was a legitimate amount of people that were prescribed, you know, the pills for a reason, and then you know,
the prescribing practices changed.
Exactly, yeah. So then it was okay, no longer. But then stopping the prescription and then having nothing, people would not want to go through the withdrawal.
Interesting.
This is actually from here. This is opiate-related overdoses last year from January 1st through August 31st.
Oh, so
this is your Providence. This is your emergency department. So you can see in that 7 months there were 688 reported overdoses. 655 is the distinct number of patients. So 33 were multiple. Someone had overdosed more than once. But you can see the range of what we're looking at. Typically the clients that I work with right now are either incarcerated, homeless, in trap houses. That's my typical clientele, and they're not usually 81 to 90. So, yeah.
What is a trap house?
Sorry, good question. It's a drug house.
I've never heard that.
Yeah, sorry. See, I know. Stop me. Yeah, no.
But use them so we learn.
Yeah, no. A trap house is where it's usually an abandoned house, and squatters will go in, and they will stay there. It's a place to use. Yeah. Yeah. So you can see that this is across the board our opioid crisis. It's kind of probably hard to see back there, but this is what heroin's going to look like. Right now there's a huge surge of fake Percocet 30s that are laced with fentanyl. Tons of overdoses have been happening with those. People think, oh, I'm just going to take a pill, and it's just one, 30 milligram Percocet, and they experience an overdose. And you can tell it's so hard to see the difference. This is the fake one. It's a little bit more narrow. And then the real Percocet is a little bit more of a bold TEC compared to this one. So I worked with a kid who was 19. He took half of a pill. He was over here from Central when he was with the buddy. They split one of these and were drinking, and he overdosed. And it was the second time he'd ever taken a pill, but it was one of the fake Percocets. So they don't know what to look for. And then this is the same with oxycodone and then heroin disguised. The powder, the purest form of heroin is going to be white. They've got like brown. That's typically what they'll refer to as heroin, as brown, H, dope. But it's usually cut with a lot of different things, which is what turns the color darker. Okay, so a couple different things here. How they're going to use heroin. This can also be any other drug that they're trying to inject. So it's the spoon, candle or lighter, the syringe. They can use it off of here. It doesn't have to be a spoon. This is the bottom of a pop can. And then the foil is for the smoking. So they will light under the foil and use, I'll show you when we get to the cocaine part, but a lot of times they'll use like Bic pens to use to smoke through. So they take out everything and then it's called a tutor. So they'll use their tutor and smoke. This is the difference. This amount of heroin, you can see the small amount of fentanyl, which I'm sure you guys have heard that's a huge thing in our county, well, our country right now, but and then the carfentanil, there's just one little gram. That's how powerful this is. It's really scary because a lot of people don't know that that's what they're getting. So, any questions on any of this? No? Okay. So short-term effects and long-term effects. You guys can see the initial feeling of a rush people describe when using heroin. It's like a euphoria. And they're always chasing that first rush, which is why this can become such a strong addiction. Slowed breathing, cloudy mental functioning. It always amazes me. A lot of people tell me that the first time they ever use heroin, they vomit. I'm like, why do you want to try it again? What? I hate throwing up. That would be horrible. Sedation, drowsiness. Sometimes the body temperature will be lower than normal and can cause an overdose. The long-term effects are going to be seeing addiction, possibility of infectious disease, collapsed veins. This is probably a lot of the stuff you guys see depending on where you are here.
I have a question.
Yeah.
So, what do you mean when you say it's cut with something?
Great question.
And with what? And
Okay,
why?
great question. So one of the best things that I saw was actually this YouTube video of someone who had like a table like this, and they spread out and they put this white sugar on there, saying that that's the heroin, okay? So they spread it all out, and then they have these little blue granules that were like the fentanyl, the smaller. So you could see the difference, and they sprinkled the blue granules all around, and then they cut into their squares to put in the little baggies. So this square has maybe 3 granules, this one has 12. There's no way to know how much because they're just, going through. So they cut things. When the fentanyl started popping up in our county, people, I know this from Evergreen at least, were taking UAs and they were coming up positive for fentanyl, and they were like, I don't use opiates, I use meth.
Yeah.
So they were putting fentanyl in their meth, and they had, I mean, that's what I mean by cut. So they add things to make it. Okay, so it can be anything, rat poison. I mean, they put so many different things in the drugs just to.
And do they put other stuff in it to make it look like there's more when they're selling it? And it's not necessarily you're not getting high off of it, or it's.
You're
it's
usually,
just
yeah, it's
Yeah.
not usually like, you know, like you see in the movies like sugar for cocaine or
Yeah.
something like that. It's not typically that. It's usually something like, I mean, meth is made with ammonia, battery acid. I mean, all these things that are, you know, you wouldn't think. And we'll get to spice in a little bit, but same kind of things, it's just random herbs and whatever they can find, yeah. Fentanyl is, like I said, it's in our county. The first half of 2017, they linked 8 deaths so far from, and I know this is last year, but it's really hard. They're trying to get new ways to, you know, detect fentanyl quicker. But there was, I thought this was so interesting. Back in September, there was a huge bust in Arlington. $10,000 or 10,000 fentanyl pills were taken from this guy. So he'd gotten pulled over and had 3 1,000 bags of fentanyl pills. And then at his house, they found, you know, $980,000 in guns and all that kind of stuff. So it's a bad day for that guy. Yeah. So detecting someone who's high versus experiencing an overdose. The overdose focusing on is going to be pale and clammy skin, no breathing, it's very infrequent, deep snoring or gurgling, the death rattle, not being responsive to stimuli, so that would be shaking, yelling, sternal rub, slow heartbeat and pulse, and blue fingertips or lips. Sometimes it's really hard to tell. Probably, does anybody work in the ER down there? Oh, yeah, like in the waiting room, you don't know if they're alive or, yeah. If they're nodded out. Nodded out is a reference to someone using a lot of opiates and look like they're falling asleep. So NARCAN, you guys all know what NARCAN is? Yeah, figured. If anybody's interested in carrying it on their own, you can go to stopoverdose.org, and there's a list of pharmacies in our county that would provide it without a prescription. Medicaid covers it. Most insurances do, and you can also pay cash. They're between $125 and $160 per kit for 2 doses.
So my insurance, Providence Insurance, I can just walk in and say, I think I should be carrying NARCAN.
And it's going to depend on your plan. You might have a copay, it might go towards your deductible, or it might be covered. It depends on each plan. But yeah, and they would give you a brief training. And
Oh,
then,
they do.
kind of like when you get a new medication. It's not really in depth, but they'll tell you how to use it.
Are you guys encouraging everybody who's like healthcare workers to carry NARCAN on them?
I think everybody should. I mean, but I am a little biased as the opiate specialist too. But yeah, so like in the trainings that I do, been lucky enough, Melina and CHC actually provided NARCAN to anyone that attended the training for free, which was awesome. The next one's gonna be in January, just so everybody knows if you wanna come. Yeah, there's been, I mean, a lot of people that come to the trainings and carry NARCAN are people who have loved ones that are struggling with addiction. They're out, you know, walking around downtown Everett. I mean, there's a lot of, there was a guy, do you guys know where Red Rock Subs is over there? So I had pulled up on the gas station side, and there was a guy sitting next to me, totally nodded out. I was like, oh my God. And I carry NARCAN in my purse and my work bag, and so I'm gonna have to use my NARCAN, you know. So anyway, so I walked over, and he was living in his truck, you could tell, and I knocked on the window, and he, you know, his head shot, but he still had the foil in his hand. So I mean, I probably wouldn't have knocked if I really would have thought he was sleeping, but oh yeah, I'm fine. But I mean, I just felt better doing that, knowing that I would have had something to help him if you know, if he was overdosing. Okay, so got drugs, picture pills. I love this. I love this percentage. Says 56% of teens say it's easy to get prescriptions from their parents' medicine cabinets, and 95% of parents believe their kid would not do that. So, and I have a 17-year-old, so I write in on this. I am one of the 95%, but I also know that my son has friends, you know, and just being aware if there's unused, expired medications. The reason I laugh is because really don't pitch them. Because you guys know that. Don't throw them away. You know, take them back to the pharmacy. There's takebackyourmeds.org that you can return expired or unused medications. But having them around just allows kids to get into them and experiment. Xanax is a huge one right now for teens, at least in South County. I don't know for sure up here. And fake Xanax bars, they're cheaper than the actual medication, but the dealers cut them with fentanyl, and that usually is what is causing the overdoses when people are using Xanax. Really hard to tell, the fake ones, really hard to tell. And they're so dangerous, especially because Xanax being a benzodiazepine, then you're adding an opioid to that. It's just a recipe for overdose.
So wouldn't they get mad if they were getting like this fentanyl Xanax for months and then all of a sudden now there's no fentanyl in it and they're like, oh my God, I feel like
yeah,
crap.
they may not realize.
It's not working.
Totally. And they may not realize that's the hard thing is, actually it was a referral from here. I was working with a woman who was not only using heroin, but she was buying Xanax on the street. And they call them pressed Xanax, because they, you know, pressed bars. And she was put on the regular Xanax. I mean, once we kind of went through some things, and she was so sick. She said, I've never been as sick as when I stopped using the fake Xanax. And depending on if you get it from someone different, who knows what they're putting in it, you know? So, it's a hot mess. Okay, meth, shards, crystal, ice, and clear. Those are the words around town for people that use methamphetamine. It's going to have a couple different looks to it. So these are the shards, and this is the powder form. As you can see, meth mouth. I'm sure you guys have all seen that. This just blows me away. 2.5 years later. It's really, depending on how long you've been here and the people that you see, clients that I've worked with, 5 years ago, and then see them now that are like still using, it's unbelievable. Sometimes it's hard to recognize people. Meth and heroin, before I go on, are used a lot together, especially in the homeless community. They'll use meth at night to stay up so that they don't get their stuff stolen, they don't want to fall asleep on the street, and then use heroin during the day. Cocaine is making a comeback.
Oh, good.
Yeah.
Why is it making a comeback?
There's a lot of different theories. One of them being there's been so much focus on the opioid crisis that everything over here is just kind of, oh, well, nobody's really looking at the cocaine or meth as much. Meth is also making a resurgence, and I don't know if that's just because people are using it together, so it looks like it's coming back, or, but it's Deputy Linnell, he's with the Drug Gang and Task Force. He said, we're seeing a lot more cocaine and it looks like it's resurfacing as a party drug. So, the difference, cocaine is only going to be snorted, crack is going to be in a rock form. This is the same thing as a meth pipe, same idea. This is what I was telling you earlier, so these little things that they sell at like the mini marts, the little flowers, they can be used as tutors. They just take this stuff out, and when I was in the jail working with the women, there were certain pens that I had to stop bringing because it was triggering them. Because they're like, this reminds me, and I'm like, oh God, okay, where's the pencils? So, I mean, it's just those type of things that they see. They're also lacing cocaine with fentanyl. Yeah.
So is cocaine not an opioid? I don't
It is
actually
not. It's a
know.
stimulant. So it's just like meth. Yeah, no, it's a great question.
What happens when you overdose on it?
It's gonna, you can.
Heart attack, seizures.
That's what I was gonna say, heart,
yeah.
yeah.
Yeah. You will seize and lose your airway,
Yeah.
same as opioids lose their airway, just different.
Just a different way because the heart is, yeah. Good question. Also designer drugs, gonna be referred to as K2, spice, or bath salts. Haven't seen as much bath salts around here lately, you guys maybe have. Spice and K2, I actually lost a patient to spice about 6 months ago. He had a heart attack. That was his second heart attack after his first spice encounter. This is what it's gonna look like. These are the bath salts. K2 spice, K2 spice. So this is a mixture of herbs and chemicals. Chemists will use something, try to get under the DEA and not have it be considered illegal, which is how they can sell them, like in smoke stores or random, trying to think of other shops that they can sell this stuff in. But the reason they're so dangerous is because nobody ever knows what they're getting. And you know, if something becomes illegal and they're not going to be able to sell this specific type of spice anymore because they've been caught up with, they're already onto something else. It's kind of like chasing a hamster wheel. These are extremely scary, especially because I think younger people think, oh, it's not pot, it's just spice, it's no big deal, it's just some herbs, but they're extremely dangerous. Effects on the mind with spice, unresponsiveness, loss of consciousness, confusion, extreme anxiety, severe paranoia, delusions, psychosis. Does that sound amazing? Effects on the body, nausea and vomiting, heavy sweating, spastic body movements, acute kidney problems, high blood pressure, heart rate. Anybody that I've worked with that's been on spice that have experienced either some type of an overdose or something that's been heart related, seizures, strokes, that type of thing. So this is National Overdose Drug Day. This is involving all drugs, excuse me. So 72,000, over 72,000. I mean, you know, it's over 49,000 for the heroin. So we've got all these other things that are playing a part in overdose deaths. And it's not going down, which is the scary part. So the last thing I want to say is that there are a lot of different ways for people to get into recovery. A lot of times people think you have to go to treatment, you have to do it this way, and everybody has a different path. And I just think that's really important to remember. All of these different paths, these different ways, could help someone walk into recovery. So that's one thing I love about my job, is being able to meet people where they're at. And what I think might look like the only way to go is not necessarily the case. It's not cookie cutter. It's everybody has a different way. And a lot of times to start, it's harm reduction, not using needles, you know, and just cutting back. So one thing I think, Gale, that you had asked about were points. Like, what is a point if someone says I use? So 10 points is a gram.
Yeah.
So like, and that can refer to any drug. So if someone's using heroin and they use, you know, 0.3, then they're using 0.3 of a gram. So it just depends on whatever drug it is. That's what they refer to in there. An 8-ball and a teener. A teener, I think, is 1.75 grams, and then an 8-ball is 3.25. So they'll refer to, they have different slang for all.
3.25 grams?
Mhm.
So if they use an 8-ball, they're, wow,
Mhm.
that seems like an awful lot.
It's a ton, yeah, yeah. It is. There's a lot of people that just use enough to stay well, you know, which they'll comment, I just want to stay well, I don't want to be in withdrawal, so that might be like $20 worth of heroin, you know, 0.2. Usually at $10 per point.
Oh, okay.
Average. average. Yeah, yeah. I mean, don't go find a dealer and say, I know, this is
And
how
they're
much."
like, no, that's not really it. You
Yeah.
gotta spend $15.
Exactly, the price may have gone up. Yeah, so, and then the other thing, I think, were dabs. People ask about dabs. Those are, concentrated, so it's THC, they extract through like a butane, and I was thinking about it. Did you guys hear about that explosion down at the new Delta hotel? It was a couple months ago. It was a couple in a room, and they had a butane thing, and I thought of that when I was thinking about the dabs. I was like, God, I wonder, just where my brain goes. But they extract the THC. It's like a sticky substance. It's very, very concentrated. It's possible to overdose on them. I had a client recently who I hadn't used any heroin, but I was using some dabs. It's like, okay, well, progress, I guess, but it's still very dangerous, so.
So it's concentrated THC. How do they use it? How do they use it?
You can smoke it. It's kind of like putting it in a pipe. I mean, they would put it in a pipe. It almost looks like a, kind of like a rock almost, but it's really sticky.
And then, so it burns.
Yeah.
And then they smoke that, whatever.
I think you can use it, and they can make it in a liquid form too. You can vape with it, I believe. So, yeah.
Is that illegal or, I mean, I hate to.
No, that's a good question, actually.
Now that marijuana is legal, if you
That's a really good-
concentrate it, does a dab become illegal then?
That's a really good question. I'm not
I don't
sure.
think it does.
It's not.
I don't think
Does it
so.
not?
You don't think it's
No, it's
illegal?
my aunt's here and she's trying to get some.
Okay, yeah. See, I don't know if they sell. It's amazing.
It's awesome for her chronic pain,
Yeah.
because her doctor cut her off all her narcotics.
Yeah.
And she's going
Oh,
through
absolutely.
mine, so
That's a
she's
huge, and
searching
that's,
for anything and everything, and that's where she's at now.
yeah, I think I think there's so many different things we can look at. That's Amy speaking, not the county. Yeah,
She's crazy.
that's pretty common. I mean, for people to, use marijuana if they're cut off.
So they sell it in the marijuana shops then?
Yeah, she's got little vape things and liquids, but the concentrate, she says, was like triple the price, so.
Yeah,
But
which
they
I think
all-
is much more safe
but
to
they
get
were-
there than
Yeah,
someone
they
that's
were talking
making
to her
it.
about dabbing, and she was asking what it was, and I was like, well, you don't need to be using
Concentrate, give it to
anything
me.
relating butane or open flames.
Right, yeah, that's the dangerous part.
2 rules.
Yeah,
Yeah.
yeah, that's funny.
Yeah.
There a clean needle exchange in Snohomish County?
There is, great question. It's in Everett. It's, oh gosh, yeah, refer them. They're amazing down there. Cherie and Matt run it. It's right next to the Franz Outlet Bakery, I think Marine View Drive, right, yeah,
Okay.
right down there. But they can go on Facebook, and they can go on Facebook and look up the needle exchange, yeah.
I've got the number, I can email it to
Oh.
anyone that wants it too.
Yeah, yeah. Definitely harm reduction route. That's gonna be really good, yeah, yeah.
Do you know anything about like the current status of Washington trying to do safe injection sites?
From what I know right now, it's not happening. Yeah, I don't know for sure. I'm not 100% sure on King County. From what I know, it's Snohomish County, but it's not safe injection sites, yeah. It's not in progress, yeah.
Do the safe, this it sounds like I know nothing, but do the safe injection sites provide certainly the paraphernalia? Do they provide the drug too?
From the ones that are currently in operation, they do not.
So they just provide the needles and clean stuff?
And then staff.
You bring your own
Yeah,
drugs
Bring your own
in.
drugs, yeah.
And
then
staff with
you're-
NARCAN.
And then you're monitored?
Correct,
So if you take too much, then
Yeah.
we have staff there too?
right.
Okay. You're from the health,
Human services?
Human Services Department.
Yeah.
Do they recommend that all of us being sort of healthcare providers, should any of our patients who are being prescribed opiates be given NARCAN nasal spray on discharge?
I can't speak for the county, but from yes.
I'm wondering if that is something that we have not done yet.
We provide Narcan to every law enforcement officer.
Yes, I know they
We
all
also provide it to Evergreen Recovery's detox. So they have 2 detox centers, one in Linwood, one in Everett. Anybody who is discharged from detox that has come in for an opiate withdrawal, they are given Narcan when they leave. Just for safety precautions. One overdose that I was at, and I was with the Linwood Police Department, and it just happened to be on the day I was with them. It was a gentleman who had just gotten released from jail the day before, and that's the most critical time that people are going to experience an overdose, is if they've gone to detox, and so there's nothing in their system, if they've tried to quit on their own and haven't used for a few days, or they get out of jail where they haven't used, and they go back to using the same amount that they did prior to going, or prior to quitting. Their tolerance has gone down, and this gentleman went back to using the same amount that he had, and he overdosed. That's the reason that we are able to do that for detox, because it's such a huge risk. It's really a risk.
Yeah, I have 2 comments on that. One is I did some research on that, and at least what the research is showing is giving a person a Narcan nasal spray does not promote or encourage ongoing drug use. So that's the initial research. There was some research study that they did. And see, so the fear would be, if I give this, am I saying, go ahead and use?
Right.
And that's not what came out.
From what I've experienced working with people, I would agree with that.
Yeah, so this study, one research study, and probably not a lot of research there yet, did not see that it promoted further drug use.
Well, and they can't administer it to themselves if they overdose. If someone overdoses, they do not know that they've overdosed. They think that they've been asleep. They have no idea. They wake up and they're usually annoyed because they're going to be thrown into withdrawal. Excuse me. So this gentleman was like, "Why are you all here? I just fell over. I was out on the, And his sister said, "I've been giving you CPR for 10 minutes." And I finally called 911.
Sing to the Lord with thanksgiving.
They just have...
Make melody.
Let's get
to
our
our
morning
God.
prayer. Oh, okay. Amazing.
See, these are what happens at the end of presentation. We are uplifted.
It's the voice of the God. Does everybody hear that? Okay, good. Okay, sorry, what was the other thing that you wanted to say about that?
Okay, so I
Pleasure.
think that we're reading about this, okay.
The Lord takes
Oh,
pleasure in
and
those
that,
who
you
fear
talked
him.
about detox
Those who
units and you
hope
talked about
his
jails. I
steadfast
think the
love.
same is true for hospitals.
Mm.
They come in
Close
here
this
and we
prayer with
alter
thanksgiving.
what level of opiate they're using, and when they leave here, they're not prepared to go back to the same dose. So I think we fall in, I don't know, what do you guys think? I kind of think we fall in that same category.
There's been a push in the ER. I was pushing our providers to start prescribing Narcan for all the overdoses that came in, and have a conversation with them with the withdrawal patients. And I got a little bit of pushback because there was a study that came out of UW a few years back that said only, I want to say 7%, but I don't want to quote that, of patients who receive a prescription actually fill it. And so, I mean, I looked into getting our pharmacy to dispense, and that was a way bigger hill than I was prepared to climb. But I figure if it's 7% more Narcan that's on the streets than was before, then that's a good thing. And I think we should be sending everyone who gets a prescription. It's like how when we prescribe antibiotics, we give them a probiotic prescription to go with it. I think Narcan should go with every opiate prescription. I think you should just get the 2 in a pair, like,
Should just be common practice.
Yeah.
It should be best practice.
Yeah.
I mean, we're learning best practice around this, because this is all so new to us. And-
Well, even the slide that showed the older adults that experienced an overdose, I did a training at a senior center, and, I mean, I don't even know if I took a vitamin this morning. I couldn't imagine trying to remember, taking pills every few hours and what I'm supposed to do. Especially with the pills that sometimes people have more, as you guys you see way more than I do, multiple different, pills, but overdoses are happening with, older Americans, and it's not because they're out slamming heroin on the corner of Colby. I mean, it's because they took a pill that caused an overdose, typically.
In general, are there resources for caregivers who are managing, say, an addict in ICU? I feel like pain management is often a problem, or we're either over-treating or under-treating. I know when we've consulted with pharmacy in the past, we're like, okay, well, they say they use, X, Y, and Z.
Right.
Understanding that there's strength differences. Is there somewhere we can go as a ballpark to try to figure out, okay, where's their base rate at, and then how do I manage their pain going
That's a
above
really
that?
good question. I think that's way over my pay grade.
So like, how much do you think 1 gram of
So,
heroin
Andrea?
is
Yeah.
equal to an
King
oxycodone?
County
Okay, yeah.
Detox
Or-
is staffed with medical providers, physicians all the way down, and I think that might be a
That's
nice
a great idea.
resource to
Okay.
call and just say, hey, based on, because I think the terminology and the slang on the streets changes over time slightly, and so, hey, where are you practicing from at your baseline today, and how are you managing these patients? Because they don't just treat with opioids, they have all sorts of adjuncts that they add to that, clonidine and, anyway, but I think that would be a great resource for you to reach out
That
to.
is a good resource.
Thank you.
Yeah.
There's some calculators online too, because they convert it to morphine equivalent dosing.
Oh,
So you
nice.
get somewhat of an idea, but then with the adjuncts as well, so there are definitely resources.
Good.
I think you could
Their
also use
plants.
vital signs too, their tachycardic and TMA, they're probably a little bit more.
Just wondering if there's, it's great to know there's a resource to go to for best practices.
We actually have an opioid withdrawal scale on Epic, we do use as well. The cows.
Is it the cow squad? Yeah. Good question, yeah. Any other questions, you guys, about anything? All right. Thanks for
Thank
having
you.
me. Yeah, no,
Thank
thanks
you.
for having me,
You
appreciate
guys,
it.
she's going to the Providence Drug and Alcohol League right now, after this talk.
Oh, check it in.
Is it that easy to tell?